Good morning. This is Dr. Bill White with the American Orthodontic Society, and I want to have two videos here together explaining the complexity of the temporomandibular joint. And I want to do the overall picture first and talk about what's going on and what the whole thing is. Like if something happens to the front part out here, it always is connected to the condyles back here, and they act too. And when you say, well, I'm going to do something to this part, but I don't have anything to do with this is wrong. Anything you do down here in this part of the teeth, it affects the jaw joint itself up here. It's part of the jaw, and the jaw is just hung on the head with ligaments and muscles and fiber that's keeping it in place. So let's get into this, and I want to show this so people will understand when something goes wrong with it and how easy it is to damage this part of the jaw. So let's get on with this. Here is a picture of the skull and everything. This is the jaw joint right here. This is the temporal bone, and this is the TMJ joint, temporal mandibular joint right here. And if you put the teeth together, as you see down here in this line, these teeth are fitting together, and there's a space above this. And this space is occupied by this retrodiscal tissue that fits up in this part of the bone pocket right in here. And this is right close to the ear, the bone structure between the ear and the joint. You can shine a light in here and almost see through it. It's very thin. And the brain structure is just inside there too. So if somebody gets a blow in the joint down here at this portion, gets hit in the mouth or just anything that drives this in a distal fashion, the person can be knocked out by the condyle hitting the bone structure going into the brain, and if it hits that, it damages the retrodiscal tissue, which is highly vascular and which provides synovial fluid and also some of the nutrients to the joint itself. And I'm going to get into the joint itself later in a complete, just as detailed as I can get with it, whatever I've learned about it and other things through many years working with it. So I'm going to erase that, and let's go show it up in different angles and everything here. The space up in here is larger than a lot of people think, and the actual tissue of the disc will be kind of it's biconcave, and then I'll show how it fits later on in this, but it goes up in here in this retrodiscal tissue. My idea of how the synovial fluid is formed in this highly vascular area, and that is the slickest thing known to man. We can't make something any slicker and better than that. And that stuff feeds the joint to some extent, and also lubricates it, feeds the disc, I say, to some extent. And this is an effective way. Now, if you have problems with this jaw joint, put your fingers in front of your ear just a little bit and wiggle your jaw from side to side, and you run your finger around and you can feel this portion of the condyle and the disc and the joint. And if you've got an infected joint up here, one that's been damaged by a blow, trauma, or somebody who grits their teeth too much, or somebody that has a dental problem where when they go to close, it causes this condyle to go back too far. It will damage that retrodiscal area and it'll swell up. And if you get hit or hurt in this area, if you get an ice pack on it real quick, keep it from swelling. Because when it swells up, now you're chewing and your condyle is hitting this swelled up sore joint. And if you just keep eating and moving this, just moving your jaw hurts. And this can get to where it just hurts somebody all the time. And this constant pressure and constant pain in there causes pain to go around the headache, and they have the neck aches and the shoulders, and there'll be pain in a lot of different areas in the mouth. You get the same pain or very similar pain by having your vocal cords get inflamed and you keep talking or singing or whatever it is and keep aggravating them, you get the same overall pain like that. So this saying that so you understand this can be hurting in here, and a lot of people don't know where it's coming from because they'll look at everything else, or used to. I think people now look at it more at what might be causing it. Now let's get on through with watching this thing. This is just the condyle now. It's a pretty bad picture of it just blown up. Now the jaw joint, the condyles are on the distal end of the lower jaw, and this is just held up in the mouth by ligaments and everything. These are little springs that were on that skull. And when you put this together, let me go back and show you. Let me back up just a little bit here. When you put the teeth together, you've got a space up here where the jaw, this discal tissue, plus the disc that fits over the head of the condyle with the thickened areas on it that's, you put the teeth together and you got this space up here. And this is thing that you get hit here, it crushes this vascular area and really tears it up, and it gets sore and swells, and that's where your problem comes in. So let's move on here now. Let me go to back again. The jaw doesn't work like a ball. You get a typodont with everything made on it. They use a ball in here. Your jaw moves from side to side, and when it does, it raises this. The condyle doesn't hit the center of the fossa, but it comes down on the prominence of the fossa. Now the head of the condyle is not a round ball. It's a, I don't know how you want to say this, kind of like a rectangle, but it's crooked in there, so that when the jaw slides over this way, one part of it comes up on top of the fossa, and when you chew on one side of your mouth, these teeth hit, but these don't hit. Now this condyle will come up on the fossa over here, and I want to go over this side. The condyle comes on top of the fossa over here, separates these teeth, and I could chew with the right side of my mouth. And when I chew with my front teeth, the whole thing moves out here on the front part of this fossa and separates the back teeth. So when you bite with your front teeth out here, there's nothing touches on the teeth at all, except the pressure is on this joint right here and on the one on the other side, and your muscles are back in this area, and they have to pull harder. If you put 10 pounds of pressure on the front, out here the muscles are way back. See, the teeth are up here, and the muscles are here, the jaw's here. So there has to be a much greater force back here than there is up here. So this disc that's in here, the dense connective tissue in the contact area takes this load, and the center part of the disc, and we're calling it a disc, it's an oblong thing like this, but this portion that takes the load is such a dense connective tissue, it has no blood vessels and no nerve endings in it, and you can jam it together and not feed it for several weeks and it'll die, but you won't even feel it, but it'll go. But this tissue is so tough. Now I'm 95 years old, sorry to say, and that's still functioning. So that's been working there since I've been an infant, and I've chewed and done everything. So this thing has to be very tough and very durable, and kind of repairs itself to some extent. So let's get on now to a little bit further. Now the looking at the condyles at the back where it fits up in here, and when your jaw shifts, I don't have the fossa here. If you go to and you chew on one side, this other side over here will crawl up on top of the fossa, and that separates these teeth and lets the teeth over here close together. Your upper teeth are not showing here. Now if you move it to the other side, these teeth will touch and these won't touch over here, but this joint will be up on the fossa head. Let me get back and can show that. And you need to understand this if you are working with people's teeth all the time, and you say, I'm just going to ignore the jaw joint because it's too complicated, I won't want to mess with it. You mess with it whether you know it or not. If you're messing with the teeth, you can put too thick a crown on the back side of a lower of your upper teeth and make a TMJ problem just doing a filling. Now here is the jaw, just the whole jaw of the teeth showing here. And you see they're not straight across. This one's kind of this way. But these function by moving the jaw from side to side out here. And the jaw is the best typodont in the world. It's different on everybody. So I don't mess with typodonts that's made to try to figure out how you're going to equilibrate the teeth out here. Doing it on a typodont with a mounted model, there's just too much difference in there. So do it with working on the teeth themselves. Let's get on now to a few more views here. All right, this is just showing them together now. And this one's headed this way. So everybody's different in here. And your muscle structure now is in this area, and that's closing this, and your teeth are way out here in front. So there has to be a lot more force back in here on this jaw joint for you to get a portion of that force in the teeth out here. When you bite something out in the front, there's more force back here on these joints than there is between the teeth out here. This has to be. And so that tissue's got to be extremely tough. And it's not fed. There's no nerve endings and no blood vessels in the very center part of this disc where the pressure goes. So I'm going to close out here on this, and I want to do a video of just this joint itself, and I'll work on that. If you look at this one and then look at the other video, and you'll know a little bit more about that. Thank you for watching.